Hello, and welcome to Picture of Health. Polk County's Indigent Healthcare Division works to form partnerships throughout the county to help the most vulnerable residents stay healthy. We have Joy Johnson, the director of the Indigent Healthcare Division, here today. And she is here to talk to us about the great work that the division does for the community. Joy, welcome to the show, and thank you for joining us.
Thank you for having me, Linda.
Can you tell us what the Indigent Healthcare Plan Division is, and what do you all do?
The Indigent Healthcare Division administers the half-cent indigent healthcare sales tax, and that funds the healthcare safety net for Polk County. And that includes a number of programs. It includes the Polk Healthcare Plan, and it also funds other public-private partnerships with other agencies in the community that also provide healthcare services to the uninsured population. In addition to that, the Indigent Healthcare Division also makes sure that the county's obligation to pay for state mandates that pertain to healthcare services also are funded through this program. So with or without this indigent healthcare sales tax, the Board of County Commissioners is still responsible for paying for those state mandates for healthcare services.
Now, why is this division so important here in Polk County?
This division is important because we are basically accountable for the expenditure of these sales tax funds. And not only are we accountable, we try to make sure that we can establish these partnerships to arrange for the services to be provided to the citizens in need. And we have the opportunity to use the funds to leverage more money coming into the county when those opportunities come up, because we are county government.
Now, in order to let people know about the Polk Healthcare Plan, can you talk about how it started, its history?
Yes, in fact, Polk County has a long history of providing healthcare services to the indigent population. In fact, going back to 1926, the voters imposed a tax on themselves to fund indigent care through the county hospital at the time, Polk General Hospital. And back in 1995, the board voted to close down the county hospital. And so a lot of people still needed the services. There was still a great need. Right. So in about 2000, Polk County ended up approving the Polk Healthcare Plan. The commissioners did. And so through the Polk Healthcare Plan is when these services were able to be provided by contracted providers, but there was only so much limited general fund dollars available to provide with such a huge need. And so in 2003, that's when the opportunity came and was proposed to the voters on whether or not they wanted to go ahead and vote for a half-cent sales tax that would fund the Polk Healthcare Plan and other innovative programs to arrange for these services to people who don't have coverage and who are going to the emergency room to get the care.
I remember the time when Polk General Hospital was closed, because a long time ago when I was teaching nursing, we used to bring our students to the hospital for their clinical experience in obstetrics. And I know that was such a, really that was such a bad situation that happened in Polk County at that time, because a lot of people were utilizing the services of Polk General Hospital. How does the plan benefit Polk County residents?
Well, it provides access to means of getting services other than going to the emergency room, and for people who haven't gone to get care because they've had no method in doing so, they didn't have health coverage. What the Polk Healthcare Plan does is it opens up a number of access sites. We have over 200 providers in our network. We provide primary care, specialty care, hospital care, diagnostics, even medications. So this gives people the opportunity to get preventive care, and it also treats their conditions and keeps them from going to the emergency room for their primary care needs or waiting until they get to the point where it is emergent. So by getting the preventive care, it takes care of what they're going through in their episodes, and it keeps them out of the emergency room.
So basically, the Polk Healthcare Plan really helps individuals to have a medical home.
That's right.
Okay. And as you and I know, I think going to the emergency room, that's the most expensive kind of health care, that you can possibly get. can you talk about how the Indigent Healthcare Division forms partnerships with different organizations?
Yes, we work alongside the Florida Department of Health with United Way on different community health needs assessments and planning efforts. And oftentimes when we look at the data that comes as a result of those needs assessments, we can see, for Polk County, for example, there's one dentist for every almost 4,000 residents. So obviously dental is a huge need. We've been able to use these sales tax funds to open up more dental access sites to people who otherwise don't have many options to get the dental care. And so we also were able to use this sales tax fund to leverage dollars through the state and federal government when those grants would become available. And the matching funds from this program generated more money to Polk County, of new money that otherwise would not have come to this community. And that helps pay for the cost of the care that's provided to people who don't have a payer source or who don't have insurance to cover those services.
Okay. Can you tell our viewers, how do they go about signing up for the Polk Healthcare Plan?
Well, they can call 534-5387 to schedule an appointment. And we try to encourage that because there's documentation that they would need to bring with them. And we can go through that list and prepare them so that when they do come for their eligibility appointment, we've gotten everything we need and we can determine their enrollment. They can also walk into our Bartow facility that's here in Bartow, and we would see them same day as well, but we try to encourage the appointments so that they have the documentation.
So basically, before they even come and sign up for it, you already have told them what are some of the requirements for them to be eligible.
That's right.
Okay.
And in doing so, that helps us be accountable that the right people are getting these services.
Right. Yes, okay. Especially because, it's being funded, as you said, by the half-cent sales tax. So basically, you have to be you have to let the community know that the funding is going to the right place and what it was supposed to do in the first place. Who are some of the providers that you work with?
Some of our larger providers would be J-Care, Doctor Today, Central Florida Healthcare has a number of locations. The Florida Department of Health is also a provider in our network, just to name a few, and they're located throughout the county.
How are these providers affected by the Polk Healthcare Plan? Are they being reimbursed the same way as other insurance companies reimburse them, or is there a specific agreement, with the providers that you have?
Well, we negotiate the reimbursement rates for our providers, and when it becomes available, if there's an opportunity for us to use grant dollars, in lieu of that, we try to do so when that does present itself. And we also, I think the value to the provider isn't just monetary. I think that there's a connection whenever they have the opportunity to provide care to someone who's gone for years without getting care. Their health is in a they have a chronic condition. And oftentimes it could be life-saving, and to know that they made a difference and that they're providing that care to someone who may have died or who may have been in the hospital for long periods of time can be satisfying and rewarding.
In terms of, you're talking about outpatient care, how about if the patient needs to be in a hospital or needs surgery? How does the Polk Healthcare Plan utilize or provide the services to these people who need inpatient care?
Well, we also negotiate the reimbursement rates for people to get hospital care in our agreements with them, but we do authorize those services. So we are a gatekeeper program, and we make sure that while we can't provide or reimburse for every service that is out there, we do try to make sure that we are not duplicating services, that the services are medically appropriate, and that we're cost avoiding funds and spending that would not be necessary. So we do have a prior authorization process in place, and we provide that information to the providers upon their request.
Yeah. And it's really just like any managed care.
Exactly.
Insurance.
Yes.
If I was on the Polk Healthcare Plan, and let's say, for example, that I need inpatient care, am I able to go to any of the hospitals in Polk County?
If you needed inpatient care, it would depend on the admitting privileges that your primary care provider or your specialist provider had. And sometimes that depends on the geographic location. And sometimes it would depend on the type of service that was needed at the time. So if that provider didn't have the admitting privileges at a local hospital, it may be arranged with another provider at the hospital that could provide that service.
Let's take a short break and learn about how to balance calories from Whitney Fong at the IFAS division of the University of Florida.
Hi, I'm Whitney Fung with the University of Florida IFAS Extension and Indigent Healthcare. Welcome back for a little bit more on eating healthy. So we're back on talking about my plate and the 10 tips to a great plate. Today we're on tip number 1 and we're going to be talking about calories. So question, how many of you all know how many calories you need to eat each day? Think about that for a second. Calories. We all need calories, right? Everybody's always talking about counting calories. Well, the average American needs about 2,000 calories per day. And calories depend on your age, your weight, your height, and how active you are. So here we have a worksheet that you can follow and look on the screen, or you could go online and find it on Family, Youth, and Community Sciences to find how many calories you need each day. That's your daily caloric needs. And again, it depends on your age, your gender, and how active you are. And you could tell how active you are by reading right here, whether you are sedentary, moderately active, or active. And of course, if you think about it, an athlete's going to need to eat more than what you need. And everybody needs calories. Calories are just a form of energy. We need to eat for energy, so make sure you have enough calories to get the nutrients you need, but also keeping in mind to balance the calories. So let's use that example, the 2,000 calories that an average American needs. So if you have 2,000 calories, you break that up throughout the day. So you might have 600 calories for breakfast, 600 calories for lunch, and then you have 800 calories left for whatever else you want to eat. So that could be a snack in between lunch and dinner, or you can have a little heavier dinner, or you can have a heavier lunch. So that, as long as you add up to 2,000 calories per day, you will be maintaining your weight, and that is the goal. You want to balance your calories. Another good way to keep track of your calories is to use a calorie tracker. A free and easy to use website is choosemyplate.gov, and there is a free resource on there called Super Tracker. So again, choosemyplate.gov. Look up on Super Tracker. You can put in all your information and you could see how you're doing each day, whether you're maintaining your 2,000 calories or whatever you need, or if you have a specific goal, if it's weight loss or weight gain or just maintaining your weight, you can go ahead and track that. So again, look up Super Tracker. It's a great resource and it's a good way to keep track on your calories. Thank you. We'll see you next time.
Welcome back to Picture of Health. I am speaking today with Joy Johnson, the director of Polk County's Indigent Healthcare Division. Joy, going back to the Indigent Healthcare Division and relating it to the half-cent sales tax, what if the voters do not vote to continue funding the Polk Healthcare Plan? What happens then?
Well, there are a number of things that would happen as a result of the indigent healthcare tax not continuing after 2019. Currently, it does fund the Polk Healthcare Plan, which provides coordinated services to the qualifying population, including specialty care and hospital care, as I had mentioned.
Yes.
But in addition to that, it serves a population of people who don't qualify for the Polk Healthcare Plan. And this could be primary care and preventive services provided through our free clinics. It could be dental services provided through our health department and our federally qualified health centers, and some behavioral health services in addition to some other outreach. So all of those programs would be in jeopardy of continuing if there wasn't a dedicated funding source to be able to compensate.
Okay, so basically a lot of the services that are available now, healthcare services that are available now to Polk County residents who do not have insurance or do not qualify for other types of insurance will see a loss in terms of the services that they receive. Is that correct?
Right, there are many access points that are provided in the community as a result of this sales tax funding it. And so without that, I'm afraid that there would be some limitations to the access for healthcare coverage for the uninsured population.
Okay. Now, in terms of the economic impact, how does the Polk healthcare plan affect the economy of Polk County? Or is there a relationship there between the Polk County healthcare plan and the economy in Polk County?
Yes, right now, because it is an indigent healthcare surtax, anyone who owns property or anyone who rents property or anyone traveling through Polk County can contribute to this sales tax if you're making purchases. So it is distributed widely among the community. It is not just on property owners. Right. So that's an added value. People traveling through, the tourists, are contributing. In addition to that, we have generated additional funding to this community as a result of leveraging the sales tax dollars. And what we are able to show is that for every dollar spent, we're getting at least $4 back in return of value of services to the community. So we're trying to spend the sales tax funding wisely while we're expanding services and trying to take care of the population in need.
Okay. So basically, everybody is a winner, because of the economic impact, and because also it's not just the residents of Polk County who are helping fund the Polk healthcare plan, but also other people who are visiting the county.
That's
correct?
Right, and it's cheaper than providing this care in the emergency room setting solely. It's less expensive, and it gives people the ability to get their conditions under control outside of the emergency room setting.
Yeah, because always they say prevention is the best cure.
That's right.
Yeah. What about if, let's say, I want to get on the Polk County healthcare plan, but after looking at all the data that I have provided to you, I don't qualify. Where do I go?
Well, we would screen you for the eligibility, and if you were not eligible for the Polk healthcare plan, we would refer you to one of our community partners. And it would also depend on the need and what services you're in need of. So if it's for primary care, it could be at one of our 6 free clinics located throughout the county. If it was for dental, it could be at the Federally Qualified Health Center or the Florida Department of Health dental clinics or Travis Dental, depending on what time of year it is. So it would really depend on where you live and what service you're in need of, but that's why we have these public-private partnerships, because they're able to provide other services to a wider array of our population, whereas the Polk healthcare plan provides a lot more services to fewer people just because of the value and the cost of those services, and it's coordinated and very comprehensive.
Now, where are the free clinics located?
We have 2 free clinics in Lakeland Volunteers in Medicine, and Talbot House Good Samaritan Free Clinic. We've also got one in Haines City, which is Parkview Outreach Community Center. We've also got the Lake Wales Free Clinic, and we also have the Haley Center, which is in Winter Haven, and then we also have another one in Winter Haven in the Eloise area called the Angels Care Center.
Okay, so there are places that these people can go in order to get some kind of health care for them and their families in Polk County.
That's right, and the services include primary care, but some of them may have a volunteer dentist that wants to donate their time. Some may have a gastroenterologist that wants to come and donate their time. So many of these clinics are actually operated by having the physicians come and donate their time. So it's a good use of the funds to provide for the operations of those clinics to have another point for people to go to get care.
So basically, it's not just primary care that is being provided to these individuals, but if they do need specialists, then there are avenues for them to get the care from specialists through volunteers or specialists who are giving their own time, to take care of these patients.
That's right. Some of the free clinics do have a number of specialists that work with them. However, if they do need a service that they can't offer, we also work with We Care of Polk County, which coordinates free volunteer, free services for specialty care through a network of volunteer physicians. So they would be screened for services, and depending on what the need was, that arrangement would be taken care of through We Care of Polk County.
As the director of the Indigent Healthcare Division here in Polk County, what are some of the challenges, that you've had?
I would probably say the public perception of the need for healthcare services. Oftentimes I think that there's some confusion and misunderstandings on what the Affordable Care Act does and who it serves. In addition to Medicaid and Medicaid expansion, and then you've got the marketplace coverages. So as the federal health reform is rolled out, state health reform is rolled out, I think oftentimes people are still left not being sure where the dust is settled and what is covered, what's not covered, who can get care and who can't get care. So I think that's probably one of the biggest challenges.
In terms of making our viewers understand it better, can you tell them about the differences between Medicaid and Medicare and the Polk Healthcare Plan and the Affordable Care Act?
Well, the Affordable Health Care Act was intended to cover all people in all states. However, one of the provisions in the Affordable Health Care Act was Medicaid expansion. And due to the case that went before the Supreme Court, it was no longer a mandate for all states to expand Medicaid, but a state option. Not all states expanded Medicaid. In fact, Florida was one of those. It did not. So in the Affordable Health Care Act, it included marketplaces or exchanges for people who made from 100% to 400% of poverty to get tax subsidies. So if they were between those poverty guidelines, they may be eligible for a tax subsidy to purchase private health insurance. However, also built in was Medicaid expansion, and because that was overturned by the Supreme Court, people who are under 100% of poverty aren't eligible for a tax subsidy in the marketplace. So, and because we don't have Medicaid expansion in Florida, there are many childless adults who don't qualify for Medicaid still. So the Polk Health Care Plan really serves those people that fall into that coverage gap, who don't have private insurance, they don't qualify for the tax subsidies in the marketplace, and they don't qualify for Medicaid.
Okay, all right. So basically, without Medicaid expansion, then it's really necessary for us to continue on having the Polk Health Care Plan.
That's right, and what this division does is that not only through the Polk Health Care Plan, but through our community partners, we try to make sure that if there's a huge need, depending on our needs assessments and the data that we review, that we can try to provide and coordinate the services to be provided. Right. For example, dental services. To be a qualified provider through the marketplaces, there's 10 essential benefits that everyone must provide. Dental services is not one of those. Right. So for Polk County, there is a huge need for that. And we have one dentist for approximately 4,000 residents. So obviously, we want to dedicate some of this funding to increase access to dental services. So even with the Affordable Care Act and even with the marketplace, there's still a gap there in all the services that are provided as a result.
And it seems like even in the commercial insurance, providing dental care is one of the things that usually is not included in a lot of the plans. So
and it is costly too.
It is, yes. Now, during your time working with the indigent population here in Polk County, have you seen any change or any improvement in the healthcare status of our citizens since the Polk Healthcare Plan was started?
I have seen some of that. In fact, we've got some data that can support that there are improvements in health conditions as a result of people having a medical home and having access to the right care at the right location at the right time. Also, I think that because of the population that we serve, we are finding or have found that many people have gone for many years without getting health care coverage. So someone who may have started out with a health condition, it has progressed to a chronic health condition. So at the time that they come to us and we try to get them into the right place for care, their condition is much worse. It tends to be more costly, and it is a little more challenging to control. So sometimes we're seeing a population that is going to have a poor health condition, and we are trying to make sure that we are able to maintain their health status and that we can manage their condition without them going back to the emergency room. They may have to battle with that for quite some time, but if they have the proper medications, the right testing to diagnose those conditions, it can help alleviate the plight that they often find themselves in.
So basically, really, it's very important for each one of us to have a medical home and to make sure that we prevent illness and we have the proper knowledge, you know, in order for us to control our health. So,
and you know, oftentimes if someone they have a chronic condition and they have to miss work, or they can't, you know, continue to show up on a certain time on a certain day because of their health condition, that can affect their quality of life. So,
Yes.
you know, we want to make sure that we are providing care, and many people who are getting services are working. We serve the working poor. So this helps them to be able to not be absent from work because of their health condition. It helps them to stay healthy so they can keep their job and be part of, you know, the working community and contribute to the local economy.
and basically the businesses, you know, really, absenteeism is one of the things that they don't want to happen because that affects the bottom line.
And it affects their quality of life.
Yes. Okay. Let's take another commercial break. Stay tuned for more Picture of Health on Polk Government Television.
After a long, strenuous workout, experts recommend consuming a serving of carbohydrates within 30 minutes. Popular sports drinks provide these carbohydrates as well as the fluids and electrolytes you lose from sweating. Based on recent research, including protein may speed up post-exercise recovery even more. A small study of endurance-trained cyclists found that low-fat chocolate milk has the optimal ratio of carbohydrates to protein and helps tired muscles recover and perform. Rapid nutrient replacement isn't necessary for casual exercisers, but can make a big difference for competitive athletes. Milk is also less expensive than high-tech sports drinks, as well as a good source of calcium, vitamin D, and potassium. For the Men's Health Minute, I'm Karen Owak with your day's Quick Fit Tip.
That's all the time we have for today. Joy, thank you for the exceptional work you do for Polk County and for being here with us today. You can watch this episode again on Mondays, Wednesdays, and Fridays at 10 a.m. or 4 p.m. on PGTV, or catch all of our previous episodes on our YouTube page. I'm your host, Linda Pilkington, and I'll see you next month on Picture of Health.